Heart health is a critical issue that affects millions of people worldwide, including many in the United States. Every year, cardiovascular diseases claim more lives globally than any other cause. Recognizing the early signs of heart issues isn't just a matter of diligence, it's a potentially life-saving measure. When detected early, interventions can be more effective, improving outcomes and even preventing death. Yet despite the prevalence of heart disease, many individuals overlook or misinterpret the warning signs. This video aims to bridge that gap by enlightening you about the subtle yet serious signs of cardiac problems. Whether you are watching from a bustling city in the USA or a quiet village elsewhere in the world, understanding these signals is vital. We are all connected by the common need to safeguard our heart health. So let's explore these crucial warnings together. Stay tuned to learn how you can act now to protect your most vital organ. Early warning signs. Number 1, chest pain or discomfort. Chest pain or discomfort, often referred to as angina, is the most common and widely recognized sign of potential heart danger. This discomfort can manifest in various forms, including a feeling of pressure, tightness, squeezing, or aching in the center or left side of the chest. The sensation might last for a few minutes or come and go, resembling the feeling of a heavy weight placed on the chest. It is crucial to understand that chest pain doesn't necessarily have to be severe or debilitating to be a sign of a heart issue. Even mild but persistent discomfort can be a warning of underlying cardiac problems. This type of chest pain is typically triggered by physical exertion or emotional stress and often subsides with rest or emotional calming. However, any unexpected chest pain, particularly if it occurs at rest or minimal exertion, should be taken seriously and evaluated by a healthcare professional as soon as possible. Angina is caused by reduced blood flow to the heart muscle, which deprives it of the necessary oxygen and nutrients. This condition is often a precursor to more severe cardiac events, such as a heart attack. Understanding and recognizing this symptom is vital, as timely diagnosis and intervention can significantly alter the course of heart disease and potentially save lives. Early warning signs. Number 2, shortness of breath. Shortness of breath, medically known as dyspnea, is a significant symptom often associated with various heart conditions, particularly heart failure, where the heart is unable to pump blood effectively. This inefficiency can lead to a buildup of fluid in the lungs known as pulmonary edema, which makes it difficult to breathe. This symptom can manifest not only during physical activity, but also in a resting state, highlighting the severity of the underlying cardiac issue. For many individuals, this shortness of breath is more apparent during activities like walking upstairs or carrying groceries. But as heart conditions progress, it may become noticeable even while at rest or lying flat in bed. In more severe cases, it might wake a person from sleep, requiring them to sit up or stand to relieve the discomfort, a condition known as paroxysmal nocturnal dyspnea. The occurrence of shortness of breath is a critical indicator that the heart is not functioning efficiently, and that the body's tissues may not be receiving enough oxygen. It is a symptom that should prompt immediate medical attention to determine its cause. Early warning signs. Number 3, excessive fatigue. Excessive fatigue or unexplained tiredness is a subtle but serious symptom that can be associated with heart disease, particularly in women. This type of fatigue goes beyond the usual feelings of drowsiness or tiredness following a long day or poor sleep. Instead, it's a pervasive sense of exhaustion that doesn't improve with rest, and can significantly impede one's ability to engage in normal activities. In the context of heart disease, excessive fatigue might be due to the heart's decreased ability to pump blood efficiently. This inefficiency can result in less oxygen and nutrients being delivered to the muscles and organs, which may leave an individual feeling constantly tired. For many women, this symptom is often one of the earliest signs of heart disease. It's particularly concerning because it can be easily overlooked or attributed to other factors like stress, sleep issues, or busy lifestyles. Heart-related fatigue can also be accompanied by other symptoms such as shortness of breath, dizziness, and chest discomfort, though it may also occur on its own. Because the presentation of heart disease in women often differs from men, symptoms like fatigue should not be dismissed. Women experiencing persistent, unexplained fatigue should seek medical advice to rule out heart disease or other underlying conditions. Early warning signs. Number 4, palpitations. Palpitations are sensations where it feels as though the heart is racing, fluttering, or beating irregularly. These sensations can be startling and uncomfortable, and they may occur suddenly and last for a few seconds or several minutes. While palpitations can be triggered by factors such as stress, excessive caffeine consumption, or certain medications, they are also commonly associated with heart arrhythmias, conditions where the heart beats in an abnormal rhythm. Heart arrhythmias can vary widely in severity, from benign to life-threatening conditions. In some cases, palpitations may indicate atrial fibrillation, the most common type of serious arrhythmia, which involves a rapid and irregular beating of the atrial chambers of the heart. This condition increases the risk of stroke, heart failure, and other heart-related complications. Palpitations may be accompanied by other symptoms such as dizziness, shortness of breath, or chest pain. Anyone experiencing frequent palpitations or palpitations accompanied by other symptoms should consult with a healthcare provider. A medical evaluation typically involves an electrocardiogram, EKG, or other cardiac monitoring tools to assess the heart's rhythm and determine the underlying cause of the palpitations. Early warning signs. Number 5. Dizziness or lightheadedness. Dizziness or lightheadedness can often seem like minor issues that are easy to dismiss, but when they are persistent or severe, they can be indicators of underlying cardiac problems such as arrhythmias or even heart attacks. These symptoms occur when the brain's blood supply is compromised, which can happen if the heart is not functioning properly. In the case of arrhythmias, the heart may beat too quickly, too slowly, or irregularly, disrupting the heart's ability to pump blood effectively. This irregularity can lead to sudden drops in blood pressure, resulting in moments of dizziness or a feeling of lightheadedness. Similarly, during a heart attack, blocked arteries can prevent sufficient blood from reaching parts of the heart, thereby reducing the overall blood flow and causing these symptoms. It is crucial to take these signs seriously, especially if they occur suddenly or are accompanied by other symptoms such as chest pain, shortness of breath, or palpitations. Dizziness and lightheadedness related to heart issues are particularly dangerous because they can increase the risk of falling or losing consciousness, leading to injuries. Early warning signs. Number 6. Edema, swelling of feet and ankles. Edema, particularly swelling of the feet and ankles, is a common symptom of poor heart function, specifically heart failure. When the heart does not pump effectively, it struggles to maintain proper circulation and blood flow throughout the body. This inefficiency can lead to a backlog of blood in the veins, which increases pressure within these blood vessels. As a result, fluid is forced out of the blood vessels into the surrounding tissues, leading to swelling. This swelling is most often seen in the lower extremities, such as the feet and ankles, due to the effects of gravity on blood flow. This condition can worsen throughout the day or become more noticeable after prolonged periods of standing or sitting. In addition to visible swelling, edema related to heart failure may also cause weight gain, puffiness in the abdomen, or an increase in the size of the abdomen due to fluid accumulation. Besides heart failure, other cardiac conditions like right-sided heart failure or congestive heart failure can also contribute to edema. In these cases, the heart is unable to adequately pump blood to the lungs or the rest of the body, respectively. It's crucial for individuals experiencing persistent or worsening edema to seek medical attention, as managing the underlying heart condition is essential to reducing and controlling this symptom. Effective treatment and management can significantly improve quality of life and prevent the progression of heart disease. Early warning signs. Number 7. Pain in the shoulder or arm. Pain in the shoulder or arm, particularly on the left side, is a classic and concerning symptom of heart problems, including heart attacks. This type of pain arises due to the phenomenon known as referred pain, where pain from one part of the body is felt in another. In the case of heart issues, the heart and the arm share common pathways in the spinal cord, which can cause the brain to misinterpret cardiac pain as originating from the arm or shoulder. This pain often does not occur in isolation but accompanies other symptoms of a heart attack such as chest pain, discomfort, and tightness. However, it is worth noting that in some cases, especially in individuals with diabetes or elderly patients, a heart attack might present only with shoulder or arm pain without the typical chest discomfort. The mechanism behind this referred pain involves the heart muscle suffering from a lack of oxygen during cardiovascular distress such as a heart attack. As the condition progresses, the pain can radiate from the chest outward to the shoulders, arms, neck, jaw, or back. Recognizing this symptom is critical as early intervention can greatly enhance survival rates and reduce the risk of complications from heart attacks. Early warning signs. Number 8. Nausea or lack of appetite. Nausea and a lack of appetite are less commonly recognized symptoms that can be associated with heart problems, particularly in women. These symptoms can manifest in various cardiac conditions, including heart attacks, heart failure, and other forms of cardiovascular disease. While these signs might seem minor or nonspecific, they are important to note as part of a broader pattern that may indicate cardiac distress. In the case of heart issues, nausea and a reduced appetite may result from poor circulation and the reduced ability of the heart to pump blood efficiently. This inefficiency can lead to a buildup of toxins in the body that would normally be flushed out, potentially causing gastrointestinal discomfort and a subsequent loss of appetite. Additionally, if the heart is not pumping effectively, organs, including those in the digestive system, may not receive enough blood to function properly, which can lead to feelings of nausea. Particularly in women, the symptoms of heart problems can be subtler and less typical than the often cited chest pain. Studies have shown that women are more likely to experience nausea, vomiting, and indigestion during heart attacks compared to men. Because these symptoms can easily be mistaken for less serious health issues, they are often overlooked or dismissed both by patients and healthcare providers. It is crucial for women experiencing persistent or unexplained nausea and a lack of appetite, especially if accompanied by other symptoms like fatigue, shortness of breath, or dizziness, to seek medical evaluation. Early warning signs. Number 9, persistent cough or wheezing. A persistent cough or wheezing can sometimes be indicative of heart failure, a serious condition where the heart's ability to pump effectively is compromised. In heart failure, especially when the left side of the heart is affected, fluid can back up into the lungs, a condition known as pulmonary congestion. This buildup of fluid can lead to an increase in pressure in the lungs' blood vessels, which in turn causes fluid to leak into the lung airways. This leakage leads to symptoms that can mimic those of respiratory issues, including a persistent cough that may produce white or pink blood-tinged mucus, and wheezing, a high-pitched sound that occurs during breathing when the airways are narrowed or obstructed. These symptoms are particularly evident during physical activity, but as heart failure progresses, they may also occur while at rest or during minimal exertion. The presence of these symptoms can be alarming, as they not only signify the worsening of heart failure, but also can significantly impact the quality of life due to discomfort and reduced oxygen intake. Therefore, it is essential for individuals experiencing persistent coughing or wheezing, especially if accompanied by other symptoms such as shortness of breath, fatigue, or swelling in the legs and feet, to seek medical evaluation. Early warning signs. Number 10, snoring or sleep apnea. Extreme snoring and sleep apnea, specifically obstructive sleep apnea, OSA, are conditions that can significantly impact heart health. Sleep apnea involves repeated interruptions in breathing during sleep, which can lead to sudden drops in blood oxygen levels. These interruptions, often caused by a temporary blockage of the airway due to relaxed throat muscles, can occur several times an hour and throughout the night, leading to fragmented, poor-quality sleep. The recurrent oxygen deprivation and the stress of repeatedly waking up put considerable strain on the cardiovascular system. This strain manifests in several ways. First, by increasing the heart rate. Second, by fluctuating blood pressure. And third, by stressing the heart's overall function. Over time, these effects can lead to more severe conditions such as hypertension, high blood pressure, atrial fibrillation, an irregular heart rhythm, heart attacks, and even heart failure. Furthermore, the effort required to restart breathing after each apnea event stimulates the sympathetic nervous system, commonly referred to as the fight or flight system, which can lead to increased heart rate and vascular resistance, further straining the heart. Given these connections, it's essential for individuals who experience extreme snoring or symptoms of sleep apnea, such as severe daytime sleepiness, morning headaches, or observed episodes of stopped breathing at night, to seek medical evaluation. Effective treatments such as the use of continuous positive airway pressure, CPAP, machines, or lifestyle modifications can alleviate the symptoms of sleep apnea and significantly reduce the associated cardiac risks. If you've noticed any of the symptoms discussed in our video, like chest discomfort, shortness of breath, excessive fatigue, or any other warning signs, please consider them as potential indicators of heart health issues and consult a healthcare provider promptly. Taking early action can make a significant difference in your well-being and could potentially save your life. Remember, taking care of your heart is crucial. Don't hesitate to reach out to medical professionals and start protecting your heart today. If you found this video informative, please subscribe to our channel and share this video to help spread awareness about heart health. Your support can help save lives.